You've been hearing a lot about this lately, Medicare. It is the federal government's health insurance for people over the age of 65 and for people under the age of 65 with long-term disability. Now, Medicare's annual enrollment period, or AEP, as you may hear it for short, when enrollees can change their health and prescription drug plan coverage. Now, it is open now. It ends on December 7th. And of course, due to the coronavirus pandemic, it's changed a little bit. You might be doing it virtually or by phone instead of face-to-face interaction. Well, here to talk more about this, we have Steve Stedman. He is from Humana, and we have Dr. Seher Zuberi, who is joining us from Iora Primary Care. Great to have both of you here. Steve, I want to start with you because things are very different right now. Help us navigate through all of this.
Yeah, I'll tell you, things are very different. And again, like you said, the AEP is here. So the first thing that folks really need to do, Susan, is to do that annual kind of look back and assessment about how things been for me this year. How's my health been? How's my plan working? We really want to just kind of, just take charge of that and take a look, give a really good assessment. And then if you want to look around, maybe you want to reduce some prescription costs, this is the time of year where you're going to do that. So we're definitely going to do the review, see what's going on, and then take a look at maybe what changes we might want to make.
Right. And because, again, things are a little bit different, you were sharing with us that during the AEP, a lot of people are able to do this virtually, and they're having great success.
We are having phenomenal success. And here at Humana, we have really done the pivot just, I think, so well because it's vitally important. I'm going to use the word safe. Susan, I know Dr. Zuberi will echo this as well. This is about keeping our Medicare beneficiaries very safe and doing this virtually like we're meeting today instead of in the studio, doing it over the phone. Even if you have maybe not a smartphone, you have a landline, we can still make that work. We can absolutely send you the materials digitally over email if you can, but maybe you can't do it that way. We'll drop them in the mail and we'll go old fashioned and do it that way. So it's just real important to know that we can meet you where you want to be met. Again, we're going to keep you safe. And let's get your new selection made. Let's get you onto Humana and we'll take it from there.
Yes, and speaking of providers, Dr. Zuberi, what should those who are watching this morning be thinking about when it comes to their doctors and selecting the right one?
Yeah, it's a great question, Susan. So I can't emphasize the importance enough of the primary care provider relationship. Your PCP is your medical home base. So having the right provider is the key on the path to maintaining your health. As you age, not like you, Susan, but I'm looking.
No.
Oh, I'm aging. Trust me on that. I think we've all aged in this pandemic a little.
Your health needs are going to change a little bit too, and you actually might benefit from a doctor or a nurse practitioner who specializes in the geriatric population. At Iora Primary Care, we offer entire care teams to help you stay healthy. In addition to addressing your clinical needs, they also look at what you eat, how you feel, and your overall lifestyle. Just like with buying insurance, like Steve had talked about earlier, going to the doctor this year is going to be a big change with more phone calls and telehealth visits. For in-person visits, which we are still doing at Iora Primary Care, you'll want to call before coming to see if there are any special precautions to follow. Telehealth, Susan, actually has been around for a long time, but now more consumers and doctors are using it in order to stay safe. It may be especially important to limit your physical interactions with others if you're over the age of 65 or you have multiple medical conditions. Let's say, for example, you have a caregiver who lives out of state. They can easily jump onto your telehealth visit, so that way they can be involved with your care as well.
That sounds awesome. And Steve, very quickly, I'm curious, are there any other virtual resources Humana offers right now?
You know what? Health That Cares is a great resource to go on. And again, what we really want to do is let's have that conversation. Again, it ends December 7th and it's going to go by quick. So don't let it get away from you. But let's review. Let's talk about what we can do. Let's get you with a great provider to make sure that we're being able to take good care of your health. And we're off to 2021.
That's right. Let's get there. All right. Thank you both, Steve, Dr. Zuberi. We appreciate you, and we want to give you that information again. If you need any help, don't forget, December 7th is the deadline. Be sure to check out healththatcares.com to learn more.